Thank you very much. We'll now call upon Mr. Andrew Connolly to give us a perspective from the New Zealand Medical Council on practice visits. Mr. Connolly.
Thank you, and thank you to the organising committee. It is our early experience, and I apologise to the statisticians in the audience that I have used percentages for things less than 100. So what is it? We call it regular practice review because we do at this stage believe the evidence strongly will support this becoming a regular event on a cyclical basis. It is, as we've heard before, very important to assess or evaluate performance in the context of what that doctor is actually being asked to do. So it's in their usual practice setting, and it should be supportive and collegial, informed by a portfolio of information. That might be audit outcomes for the interventional specialists, it might be logbooks of operative data or such like, might be prescribing data, it might be uptake of patients going into screening programs in family medicine. And on the day, a range of tools may also be included, such as reviewing of notes, obviously observing the colleague as they go about whatever their normal practice is. So it may well be a ward round, something to do with outpatients, something in the operating theatre. And multi-source feedback, obviously, we believe also has a strong role to play in this. My talk is about the vocational registered doctors, but we have introduced mandatory practice review for the General Registrants, and about 100 have gone through that so far. We have done a public survey. This was done by the Council, by an independent organisation, and 75% of some 550 respondents said that they would have increased confidence in their doctor if they knew their doctor was regularly reviewed by their peers. And as I said, it's now compulsory for the General Registrants. So our early experience comes from 4 sources, and very grateful to the New Zealand Orthopaedic Association, the College of Obstetrics and Gynecology, General Practice, and the College of Physicians. We are aware that there are other colleges and other fellows who are doing things. Some of the psychiatrists in New Zealand have taken it upon themselves to have practice review with support from the college, and some surgeons in other disciplines other than orthopaedics, but Council doesn't have data on those outcomes. So if we look at the New Zealand Orthopaedic Association, I must say my colleagues in the theatre tea room groaned and moaned when they started hearing about this in orthopaedics, but they all actually enjoyed it. And essentially the feedback has been extremely positive. 95% of those surgeons visited, so the receiver of the review, if you like, felt that it did provide a very good opportunity to talk over practice issues, both clinical and professional, as well as looking in particular at their work-life balance, which is obviously a concern for many. And of those surgeons doing the visit, again, very high number felt the visit was worthwhile in assessing professional attitude, looking at that overall issue of work-life balance, and being able to address certain practice issues that may have come up during the day. 66 or so respondents here. I think the Orthopaedic Association is now up to well over 100 who have gone through the program. But again, 9 out of 10 visitings of the surgeons being reviewed strongly supported the introduction of a practice review as a mandatory component of their CPD for orthopaedic surgery, and a similar number of those performing the review, and indeed overall 92% supported introduction of the program, funded by an increase in the NZOA subscription, and that has indeed taken place. If we turn to the College of Gynecologists, similar number, 68 respondents, around 85% said that this was either very effective or effective as part of their CPD. A solid little core of 15%, however, disagreed. If we split those into reviewer and reviewee, again, very similar findings. Around 90% felt that there was a strong or moderate influence, and we actually checked that that was a positive influence, and it was. Again, of some concern is that 20 odd percent who didn't find this valuable Whether or not those are the problem children or the very high performers, we don't know. But I think the key from this slide is that both sides of the process, the reviewer and the reviewee, have found this a process from which they have learned in a positive fashion. Only 30 of our general practitioners so far, and obviously the data present in a slightly different way, the reviewers in blue, reviewees in red, but good concordance in most areas between the assessment of the outcome or the benefit of the visit. In particular, providing encouragement and support, assisting in clinical practice, communication skills, learning needs, which then feed into ability to self-direct learning and prioritise professional development. Interestingly, record keeping, which is an issue that in New Zealand is often brought to our attention as a problem area, it was interesting that more of the reviewees found it beneficial than the reviewers. But now that I don't have the answer to this question, but whether it's around electronic systems or whether it's around the contents of their notes, etc., don't know. But it was an interesting finding, and obviously the ability to learn from the reviewer in terms of just how to run the practice, how to run the business. And if we turn to some of the comments or some of the conclusions that came from the feedback, everyone who's been through it believes it should continue, and the vast majority believe that the College of General Practice should make it compulsory. The reviewees, opportunity to reflect, review, take stock. These are verbatim comments in some of these. Independent review of practice. Feedback on observed consultations and record keeping was found to be extremely good. And quite a number of the fellows in the College of General Practice commented it was the first time they'd had an outside colleague come and look at them since they obtained their fellowship, which is probably a risk area for people who are outside of hospitals or major institutions. The reviewers also gained insight into the other person's practice and were able to reflect on their own style of consultation and their own clinical practice and practice management. The Australasian College of Physicians has had a pilot in New Zealand. I don't know the number, it will be small. And I think there's another pilot beginning at Waitemata Hospital shortly. The feedback was it was a useful exercise that provides support for the individual clinician. And interestingly, and as previous speakers have touched on, there was feedback from some of the physicians that it allowed an overview also of the systems and the hospital in which they're having to work. And so it may have benefits for looking at service delivery and the way individual clinicians are involved in that. Obviously, the ability to reflect on professionalism, and it was thought that because it's a very collegial process to go through, it may help break down some of the risks of becoming isolated within your practice. So what are we doing as a council? Well, we are actually studying this avidly. We want to try and answer these questions. Some may be a little easier to answer than others, but does a regular practice review help the doctor involved identify areas of strengths or weaknesses, and therefore does it assist in planning their professional development over the next cycle? Do doctors actually take note of the report and make any changes? There was some feedback that the written report was far less valuable or of far less assistance than the actual talking on the day between the reviewer and the reviewee. Does regular practice review impact on quality of care, and therefore does it also impact on clinical outcomes? Again, this has been raised earlier, and we do have a number of surrogate markers collected by the Ministry of Health that can help us here. We also have a lot of data from prescribing, etc., that we can work with. But I think it's very important we realise that this will take a long time to answer the quality and clinical outcome questions, but we also must make sure we're gathering information that is useful. And of course, the final point is, does this truly help reassure council and also the public that competence is being maintained. We obviously need more time, more numbers, but we're also looking, of course, at whether a doctor who's had a practice review is more or less likely to get into the pickle with council over the succeeding years. What happens if we identify a problem? Most of these are something that's sorted out on the day, a chat between the reviewer and the reviewee. It might be, gee, you're a little 1990s on your diabetes management, or your rigid hatred of the laparoscope may not be appropriate if you're taking out gallbladders. Of course, the mentoring and professional development plan we would hope would be strongly influenced by what's discussed on the day, and there's an opportunity to upskill via that. If concerns are of slightly greater level, it may be that the Chief Medical Officer of the institution, if you're employed in a hospital or a group practice setting, or the responsible officer, to use the UK term, would become involved. And we encourage any reviewers who have concerns to discuss these with Council's medical advisors. So far, out of probably around 300 doctors who have now had practice review across the whole RAE, we've had 2 or 3 where there's been a discussion with Council's medical advisors. It could, of course, lead to a notification to Council if significant concerns exist, and then our processes, such as a performance assessment, leading, if there are indeed significant issues, to a recertification program or a formalised education program may kick in. So in summary, our experience is very early, but it has been very well received, and I think it is fair to say this has been somewhat surprisingly well received by the people who have been through it themselves. There's clearly, in the people who have been through it so far in New Zealand, benefit to both the reviewer and the reviewee, and it is identifying areas for professional development. It's seen as collegial, which is absolutely crucial. It will just wither and die if it's seen as an examination. And our ongoing review of its effectiveness with greater numbers and more rigour around the statistics and data, we hope to have our first evaluation report out about this time next year. And I'll just simply, in conclusion, just acknowledge the strong support, which is absolutely crucial, from our colleagues in the colleges. Thank you.